Unions have played a key role over the centuries in defending employees' rights and bargaining for better treatment. Over the years, different laws have been put in place to curb the powers of unions, threatening their freedom. This week on Health Watch, we take a look at unions in the health sector, their impact to the society and the laws affecting them. My name is Saada Hassan. Historically, unions in the country have taken industrial actions as a way to bring their employers to the table. From the year 2011, Kenya's health sector has witnessed a wave of strikes from its health workers. In 2016-2017, doctors were out for 100 days plus bargaining for better working terms. It's not only health workers. Different sectors have taken that route and the results have been promising until recently. In 2016, one Joseph Otieno Oroch filed a petition seeking to challenge the right to life and quality and timely healthcare services with the Kenya Medical Practitioners, Pharmacists and Dentists Union, as well as the Kenya National Union of Nurses as respondents. Labor law expert Okwe Achando says that the petitioner wanted strikes for health workers ruled out. However, the constitution protects workers over such.
There were three issues in that case. Of course, I didn't deal with the matter. One, the nurses union filed what is called the preliminary objection. The first preliminary objection and second preliminary objection. There are two preliminary objections questioning the jurisdiction of the court to determine this matter. In their view, the matter should have been determined by the High Court in terms of the Constitution, involving the interpretation of the Constitution. So the court addressed itself to that, and also that the petition was not precisely drafted, that it did not spell out the constitutional issues which were alleged to have been violated. The court decided those preliminary objections and returned negative verdict. That is, they did not hold any water.
Industrial actions often threaten the stability of workplaces. In Joseph's petition, key issues outlined as triggers to the petition are: quality healthcare is deteriorating steadily following frequent strikes by doctors and nurses due to various grievances. Reports from mainstream media over-reported deaths in August 2015 that were attributed to doctors and nurses' strikes. KMPDU's Secretary General Dr. Davji Atala says that the right to go on strike is protected and the petition tries to undermine that.
Currently, with this COVID, we are seeing many people dying because there are no ICU beds that are not available in the hospitals. We see many people are dying because there are no doctors, there are no nurses to attend to them in those hospitals because there's a shortage of it. We see many people also dying because there's no oxygen. Otherwise, if a patient is given this oxygen, they will actually survive. We also have those previous cases whereby you have a patient that comes to the hospitals, you send them to the lab, and the labs cannot give you results because the lab is not working. You send them to the pharmacies, there are no medicines. You have a patient that is almost dying, you're trying to resuscitate, but there are no equipment to do this. This is what formed the strikes that take place in the hospitals, because at most instances you try to bargain with the hospitals and to sit with them to discuss framework to offer services. But mostly, in almost every situations, the counties do not act until you give the strike notice. That's when they want to sit down and discuss these matters with you. So essentially, the strikes that healthcare workers participate in is mostly the dignity of the healthcare workers, because every time when you go to the hospitals and you only spectate and see deaths, it affects you because you're a human being. So it's the dignity of the doctors and the dignity of the healthcare workers. That's why they participate in these strikes.
The chairman of the Kenya Union of Clinical Officers, Peterson Washira, says that the petition only addresses one issue and fails to look at the constitution in whole.
If you look at the constitution of Kenya, the right to strike is given under Article 41, and it is given to the individual employee. So that right, they only come together in a union to exercise it. If you want to limit that, the Constitution provides for the same. It provides that if you want to limit any right, you must do it through a law, and that law must be seen to be justifiable in an open and democratic society. And it goes on to say that limitation must not be seen to deviate from the purpose of the right that had been granted.
The right to life under Article 26 of the Constitution is far much, or is more important than going on strike as encapsulated in terms of Article 41 2D of the Constitution, and should be prohibited. So what it was doing essentially was to invite the court to invalidate a constitutional provision.
According to Section 81 of the Labor Relations Act of 2007, essential services have been described as services that would probably endanger the life of a person or health of the population if they are disrupted. It further lists the following as essential services: water supply services, hospital services, air traffic control services and civil aviation telecommunication services, fire services of the government or public institutions, post authority and local government authorities, and the ferry services. After the promulgation of the 2010 Constitution and the fundamental rights and freedoms were introduced, an alignment of the 2007 labor laws and the 2010 Constitution has not been enacted.
Constitutionally, there's no definition of the minimum services in the health sector. And I will tell you, without any contrary or any information or contradiction, that currently, the way hospitals have been operating in this country, they've been operating minimally. According to we look at the recommendation of the personnel by the KMPDC, that is the Kenya Medical Practitioners and Dentists Council. There's a recommended number of staffing that need to be in every hospital. There's a recommendations of how every laboratory should operate and how the medicines and what is needed to be in the hospitals. If you look at that recommendation, you realize that the hospitals are actually operating at bare minimum. And that's why they need the interns to help operate them. That's why even the UHC was trying to put doctors in those facilities. So essentially, the hospitals are operating at minimal because the counties have not been employing for more than 4 years now, and the national also has not employed.
This is something that we will be appealing because it's something that cannot be let to stand. We understand that there is right to life and there is right of the healthcare worker. And all the time that we have gone on strikes, we balance this because just look at the example of the strike we went last year during COVID. We started trying to engage the ministry since March of last year. And it's only in December when we realized that they were actually not going to give us anything tangible that would actually be able to protect us. That is when we went on strike.
According to the recent ruling delivered by Judge Monica Mbaru, Judge Joram Abudha, and Judge Lynette Ndolo, the court agrees with the petitioner. The Ministry of Health, together with the Ministry of Labor, are to respond within 12 months by developing and publishing guidelines to give an effect to the order. What does this mean to the unions?
I think the end goal and what this will do is that it's going to dilute the necessity of having the unions and by far kill the unions. And that has been the intention. And this is something that the state is trying to do. We have seen it. We have seen what they have done with NATS. We have seen what they try to do in the health workers unions. They even stopped our deals because they want to find ways so that we can not be able to operate. So it's a move that we know that the state is trying to actually kill the unions. We just hope that the courts are not playing along.
My reading of that judgment is it does not take away their right to go on strike because a minimum workforce is supposed to be left to attend. If the fire people decide to go on strike, the union, I don't know which union deals with firemen, if they decide to go on strike, then there is supposed to be a minimum number. You give the minimum number, the There are areas of operation that they are in this.
Judith Gusera, a labor law expert, says that the judgment is not in good faith and it is the modalities that should be looked at.
Parameters, the basis, the implementation has to be worked upon by the parties. The court cannot just declare they cannot go on strike. It is wrong. And that's why we are headed to appeal for it to be restated properly. Because what is going to happen? The employers are going to sack any doctor, any nurse or clinical officer who is going to go on strike, and they'll be citing this case. It is not put in the right context.
What is happening now is that the unions in the health sector are being seen as resistance movements, and that is why they are being fought. And that should not be the case. The unions should be treated as social partners that are very important to ensure that you have a very motivated workforce to be able to build an economy. And that is what is lacking, and that is why the state is fighting the unions.
In any way, at any particular time, we ask the Kenyans that when you go to a hospital and you can't get services, you do not need to keep quiet. You need to ask your government that the person you voted in, what are they doing about the doctors that have not been employed in those hospitals? What are they doing about the shortages? What are they doing about lack of laboratory services? What are they doing about people sharing beds and some lying on the ground? So this is an issue that needs to really be discussed and be pushed so that we have change in it.
Despite the challenges facing unions currently here in the country, it is clear that unions are here to stay as they play a key role in defending and bargaining for the rights of employees. Saad Hassan for Health Watch, KTN News.